biggest opportunities for the Starkey Hearing Foundation as far as getting better in 2015 is training. You know, just getting more information out there, up-training our country coordinators, our hearing coordinators in the field, and getting them the resources and the tools that they need to do a better job. Come to a point that Bill and I decided we would do separate initiatives, that I could do kind of a quality control patrol right behind the missions that we did late fall, early winter. And so I'm taking a team and doing training and aftercare and actually doing pilot programs for a small amount of people on phase 2s. So, you know, we've come a long way in 2014. So we're starting 2015 by doubling our efforts with 2 teams out in the field. We have exceptional support from the government, from the ENT audiologist here, Dr. Kayatesi. We have 11 provincial hospitals, all with dedicated nurses for our phase 1, 2, and 3. So it's a pretty big day for the Starkey Hearing Foundation and the model being accepted into the government program.
I regard hearing, or the ear generally, as a neglected part of the body. It's small, and usually the problems that affect the ears tend not to be necessarily painful or life-threatening. So people think that it's normal to live with it. They can go to their fields and dig, the kids can go to school. But the long-term effects of those problems are hearing impairment, which affects the communication and cuts away the children from their learning experience, the parents from their families. It affects their quality of life in all aspects. So it's important to have people trained for them to be aware of the existence of ear problems and the fact that those problems can be treated and the quality of life improves.
I'm called Chelsea Immaculate. I'm professionally a nurse, but I'm currently a GHC, Global Health Corps Fellow. Yesterday we had an awesome training. There are some things that I didn't know, and when I go back to the hospital, that's why I will be able to apply all the techniques I have learned.
We needed this help, we could not dream of it. It's just fantastic for the country and everybody who has been assisted, and us who have acquired the skills and knowledge of how to assist others and take care of the hearing aids.
Follow me, I'll be a river, river, I'll move the mountains for you.
One of the most rewarding things that I get to see on the field is our coordinators gaining the skills they need and growing into their role as providing aftercare for our patients. So we have a lot of strong African women that are running our programs, and I learn things from them every day.
Here, all the 3 ministries are involved, you know. And so you realize that it takes 3, not 2, it takes 3 to tango to get this program to work. And that is one thing that I promised that I'm going to do when I get back home. I need to get everybody else on board. You always have to be able to approach people. Let them understand where you're coming from. Let them feel what you feel. Once that feeling comes in, people understand where you're coming from and they jump on board. And that's precisely what I'm going to do.
A woman, first of all, is a mother. And a mother always walks with her children. And you know, they say one woman can change the whole world.
When you educate a woman, you educate a nation.
Tani, she's a good example of a strong leader. She's a mother, she's a boss, she's good. You are able to interact with her. If you have any question when she's teaching you, you can ask, and she's also a good teacher. She has really inspired me.
I really believe we're starting a movement. You know, it's not just a training, we're starting a movement into the community-based hearing healthcare program where it will not just be a hearing health program, it will be a world hearing health program.
Wherever you're standing, I will be by your side. Through the good, through the bad, I'll never